Hi, and welcome to Exercise in Place, Part 3, Fall Prevention and Response. So again, welcome. My name is Jerry Williams, and I am the founder and president of Myositis Support and Understanding, MSU. We are a 501c3 nonprofit organization. We are all volunteer, and we work to improve the day-to-day lives of myositis patients and caregivers. And one of the ways that we do that is through education and support. And a lot of you are probably part of our support programs, and we appreciate the support that you provide to each other and to us. This is Fall Prevention and Response, and joining me tonight is Lynn Wilson, the Vice President of MSU. Hi, Lynn. And our famous now OTPT team from Johns Hopkins Myositis Center. There in the center, you'll see Megan. Hi, Megan. To my left is Ruben. Hi, Ruben. And to my right, off screen a bit, there he is, Finn. Finn, thank you guys. We appreciate your time in doing all of this for us. Again, I've briefly introduced our speakers tonight. I have Lauren listed here, and she's not here tonight, but she sends her well wishes to all of us, and we certainly appreciate that. Settle in. The session is being recorded and will be available on our website and our YouTube channel. And with that, hi, Megan.
Hi. So first, just a quick disclaimer. We do work at Johns Hopkins in the Hopkins hospital system, but anything we talk about in terms of exercise or equipment, always consult your physicians, physical therapists, and occupational therapists regarding your individual needs. And we do not endorse or recommend any particular products mentioned in this presentation. We don't have any financial interest in any of our products or with any of the vendors, and that this is for general information and educational purposes only. And we are not, the information is not representative from the Johns Hopkins system itself. We are talking based off of our own personal experiences and our knowledge within the myositis world. So the first question we kind of want to tackle is, what are the most common causes? So on the next slide, what I put together was the most common causes of falls that we hear here at our clinic. So when I evaluate somebody, I always ask, have you had a fall recently? And if they say yes, I ask, in what way? So some of the most, and so I want to talk about a little bit, what I hear people say, and then a little bit about the anatomy behind it. So what's causing that to happen? One of the most common ones is the first bullet. I tripped over my toes or I stepped my foot. And in the world, especially with inclusion body myositis, what we see is foot drop, because those muscles are weak, the muscles that bring your toes back up. And so one of the more common repercussions of that weakness is that you will trip over your toes, stub your foot, catch your foot on like thresholds, or have trouble getting it up the stairs. The next one is my knees give away or my legs buckled. It could be kind of suddenly standing there, or when they're trying to regain their balance a little bit, their knees will buckle, and that's kind of represented or caused by the weakness in the quadriceps muscles or your thighs. The next one is we hear is, I got so tired after working out and my legs just gave out. Fatigue is a factor when it comes to myositis. And when we do a lot of activity, whether it's just daily activity or exercise, and your muscles are fatigued, you are at a higher rate or chance of a fall. The next one I hear is, someone bumped into me, I began to lose my balance and couldn't catch myself. When it comes to myositis, again, those muscles that cause you to react and regain your balance can be very much affected. And we're going to be talking about some exercises to address those muscles. The next one, the ground was just a little uneven and I couldn't steady myself. Again, that's a common thing we hear anytime someone's on an incline, a decline, outside on grass or uneven sidewalk. Again, those muscles that allow you to quickly react and keep your balance are affected by myositis. The next one is my legs buckled when I was trying to get up from a chair. With myositis, that transition from sitting to standing is so affected because the muscles in your thighs are affected, and so that transition of getting off of a bed or off of a toilet or a low chair can cause falls. One says, I lost my balance when I tried opening the door and it knocked me backwards. I actually hear this most with kitchen appliances, like if you're opening a dishwasher or a fridge or a washer or dryer, and it takes a lot of effort to pull that door open. It can cause someone to make their momentum go backwards. And again, those muscles that allow you to react and catch yourself are affected. So people can fall backwards, which can be a dangerous fall because that can hit your head. I fell when I tried to bend over to pick something off the ground. So squatting, getting down to the ground, a lot of my folks will tell me it's difficult to get back up given that those muscles in the legs are so effective. And then I just wrote stairs. And I saw someone's comment about curbs. Curbs are another one, especially if you're going out in the community. Stairs and curbs require you to put all your weight on one leg while maintaining your balance and putting your other leg up or down. And whenever we remove one of our base of support, we're more likely to have a fall. Now, of course, there's other causes of falls like pets and little kids, but these are what I would say are the most common causes of falls. So the common theme is those leg muscles that are affected, your reaction, your ability to quickly regain your balance, and the muscles that bring your toes up so that your foot can fully clear the ground. Those are the main causes of falls. So we can go on to the next slide. So before we get into any kind of balance exercises or the real good stuff that Ruben's going to talk about, how to actually get off the ground, let's first talk about prevention, because there is a fair amount of things you can do to prevent having a fall or to create the most optimal situation for a fall. So we can go on to the next slide. So first thing is, if Lauren was here, she would talk about this. This is energy conservation, and it's something that's so important. When it comes to myositis, fatigue and poor energy is a common symptom. And so what happens, like I talked about, if you're doing a lot of activity, your muscles get fatigued, you're at such a higher risk of falling. And so you have to really think about your day when you start. You have to think, okay, I only have a certain amount of energy for this day, and how am I going to make sure I spend it wisely to make it through my day safely? I always tell people to think of your energy as a dollar bill, and you have $1 to spend on the day, and you have to assign your activities different costs. So if showering, for example, costs 40 cents and playing with the grandchildren costs 75 cents and making dinner costs $1.30, you're really going to have to think about how can you adapt some of those activities so that you are not spending more energy than you have. When you get to the point of spending more energy than you have, that's when you're at that high risk of falling. And someone mentioned the spoon theory, and absolutely. When I was at conference, we talked a lot about the spoon theory in my women's only group. If you haven't heard of it, you can just Google the spoon theory on Google, and it's a great way for you to read and actually print out an article that you can hand to loved ones to help explain what it's like to live with fatigue and decreased energy. The next thing on this list for fall prevention is body awareness. Because your muscles are affected by the disease, you have to use some of your other senses to control your body. For example, if the muscle to raise your toes to clear the ground is affected, you might have to use your vision or your tactile sense, your sense of feeling in your feet to compensate for that. And then there's other additional ways to compensate, like what we'll talk about with equipment. But knowing exactly how your body is moving, understanding your strengths and your limitations, and accepting that is a huge piece when it comes to fall prevention. My folks who come in and say they've had 16 falls and it's from the same thing, and they're going to keep trying to hike and they're going to keep, they're never going to use the walker because it makes them look old. And, you know, those are my folks that haven't truly accepted where their body is at in that place that I worry about, because no fall is a good fall. You're never going to hear us say, oh, it's okay to fall, because really it only takes one fall to really do some damage. So we want to do anything we can to prevent a fall. The next thing on there is pre-planning activities and delegating tasks. That kind of goes along with energy conservation. So pre-planning your day, if you know you have an activity that's going to require a lot of energy or stress, or if you know that you're going to a house or a park that you've never been to, you might want to do a little research on, you know, are there stairs? How smooth is the path in the park? Is there an incline, a decline? Are there benches to rest? And so on and so forth. A little bit of extra work in the beginning to plan for an activity can pay dividends. I'm sure a lot of people have stories of going to a restaurant or a kid or a grandkid's sporting event, or whatever that activity may be, and they get there and they find themselves stuck in a situation where there's a full flight of stairs to get there, or they have to walk across an entire field of grass to get to the soccer field their kid is playing at, and they find themselves a little stuck. But if you do that planning ahead of time, you can try to reduce some of those situations. And delegating tasks, it either kind of, you love it or you hate it. You know, some people love to have other people wait on them hand and foot, and others want to be really independent. And I say there can be a middle ground. You can be a really independent, strong-willed person that has to ask for help sometimes. I mean, the best of us do. And if asking for help to fold the laundry allows you to have more energy to go play with your grandkid, I think that's worth it in the end. The other part of fall prevention is looking at your house or your environment and setting it up so that you have the least amount of chance of falling. I talk to a lot of my patients about this in depth, because your house is your ground, and unfortunately right now in this pandemic, your house is probably the place where you're spending nearly all of your time. So I'm going to go over a few of these things, and if you guys have any questions, you can ask in the Q&A or the chat box. But some things you should be mindful of is look at your flooring. You'll want to remove things like scattered rugs, or if you have floor rugs, you want to make sure they're adhered really well to the ground, because that foot drop can be an issue. Floor rugs, clutter on the ground, electrical cords, and door thresholds can be a tripping hazard. Look at your doorways, especially going into the bathroom. Look at the threshold and determine if it's something that you can negotiate or if it's a tripping hazard. If it's a tripping hazard, they offer miniature threshold ramping I don't even know what to call it, but it's pretty much a piece of rubber that can go right over that threshold to make it so that it's a smooth incline and decline rather than a jarring step. And then look at the bathroom, you know, putting in grab bars around the toilet or making your toilet higher is going to allow you to complete that transfer on and off the toilet with more control, reducing your chance of falling. And look at the shower. Walk-in showers are always going to be the safest option. I know renovating a bathroom can be pricey, but tub showers can really be a dangerous thing when it comes to stepping over the tub with someone with myositis. If you can't get rid of that tub, there are things like tub transfer benches that can go right into the tub, set over the tub so you can sit and slide in. And if you can, using grab bars in the shower. My folks with inclusion body myositis say that getting on and off a shower chair actually increases their risk of falling when they're in the shower, and they much prefer to have a grab bar or have a very small walk-in shower so they can lean against the wall rather than have to try to negotiate a transfer on and off a shower bench or chair. Let's see. One of the things that people talk to me a lot about are stairs. And, you know, they say, should I sell my house for a first story setup or a condo? I mean, ultimately, that's your choice in the end. But stairs are a place you never want to have a fall. So one of the most common things people will do is they'll buy or purchase a stair glide for the stairs. Maybe they're having difficulty with, you know, negotiating the steps. And my biggest piece of advice is if you buy or want to purchase a stair glide, figure out the height of the seated surface of the stair glide to the ground. Because with inclusion body myositis, folks have, or any of the myositises, getting from a sitting to a standing position takes more effort, often some rocking to get up from a seated surface. And now think about how a stair glide works. You're going to be sitting, you're going to ride up the stairs, and then you're going to be at the very top of the stairs using a lot of effort and maybe some rocking motions to get to a standing position. You don't want to have any issue getting up from that sitting position when you're at the top of the stairs. I have folks who have the stair glide and they say it works for them and it's fine, but my biggest piece of advice is make sure you know all the measurements and that you can safely get up from the seated stair glide surface. Alternative to stair glides, unfortunately, would be elevators. I know elevators are not inexpensive. They're probably the most expensive thing, home renovation you can think of. But I just wanted to make that point about stair glides. Other things, yeah. You want to talk about this, Finn? Finn talked.
That's fine.
So, well, I'm gonna set that there. Maybe we can talk about it in a bit.
Oh yeah, whatever.
Yeah. Other things I wrote in on here, for example, are like a front-loading washer and dryer on risers, electrical outlets that are raised. Know that if you're bending over to plug or unplug something, you're more likely to fall. Using bedroom shelving instead of dressers with drawers. And I talked about this when you're using a lot of force to pull something open, you're more likely to throw your momentum backwards. So anytime you can reduce the amount of time you have to forcefully pull something open. The liquid soap, shampoo, conditioner dispensers on the wall, that's more if you've got weak grip, and opening a shampoo or conditioner is tricky in the shower. That might not be necessarily a fall risk, but it's a good idea. Making your furniture raised, either putting raisers on the bed or the couch, or thinking of those lift chairs, which are recliners that elevate. Creating automatic doors. I got this idea when I was at conference and I was talking to some folks. It was a caregiver who said his wife had tried to open a refrigerator door and fell backwards, and he actually installed the device that you use to create automatic doors that you walk through onto his refrigerator, and created his refrigerator an automatic door. And I thought, oh my gosh, that sounds too expensive and too much work. And he actually told me the price, and it was ridiculously inexpensive. He happened to be handy, so he could do it on his own. But regardless, I just found out that this is an option, and if nothing else, it's an option. Also think about your outside of your house, making sure your sidewalks are smooth, or if you are walking in the community, choose parks that have paths that are smoothed over. And the last one is just, you know, hitting a dead horse at this point. Get rid of those throw rugs or thresholds, anything to trip over. One of the things you can do for home safety or the ideal home setup is you could look up home safety evaluations or home safety checklists. I know that like AARP, the ADA, even Medicare, like all these different organizations have home safety checklists that you could go through your house and say, okay, what can I do to this house that can make this the safest environment to prevent falls in? All right.
Before we move on from there, just when we were talking about the stairs and the stair glides and stuff, I don't know how familiar people are. I know a few people have been familiar with this, but it's this product. It's a cane, just a regular straight cane, but at the bottom, it's a platform that's about half the size of a step, half the height of a step. So it's just
Here, put it back here.
as you're, I don't know if you can see it from here. This is backwards. But, you know, if a step is too high for you, you can use this cane. It gets you half a step up, and then you can step up the rest of the way to this step. So you just bring it up every step. And, you know, if 8 inches is too high for you to step up, this, you know, you can do it. Okay, now I can do it with 4 inches instead of 8. So it's pretty cheap. It's remarkably, it's light. It's just plastic at the bottom, but it actually holds, I think the weight limit was something like 350 pounds. So it's light and sturdy. So it's just another option to make the stairs a little bit easy, a little bit less of a challenge, and less likely to have a buckle and a fall.
So what are the options for equipment or bracing to prevent a fall? Next slide, please. So one of the bracing options that we use for myositis patient, this is called the ground reaction ankle foot orthosis. We primarily use this and recommend this for patients with inclusion body myositis. Then there's a certain criteria that you have to meet before, you know, we start recommending this. One of those criteria is the quad strength. We don't normally recommend this for everybody or for all IBMs. Usually those IBM patients who have like mild quad weakness, those who can still able to recruit their quadricep muscle when they starts to buckle, they can still you know, pull the knee back. Those are the ideal candidate for using this. Those IBM patients who have severe muscle weakness and they couldn't activate their quads, you know, to help them from falling, the brace will not be strong enough to prevent the knee from buckling and helping you from you know, prevent falls. So the way it works, as you can see on these pictures on the right, there's a this front cup pad is the one that goes in front of the leg, and it, you know, it wraps around it, and that's the one that provides the knee stability. So when you get to a point in your gait where you're bearing most of your weight in your leg, which is called a single leg stance, and that's the part of your gait where you're most likely to buckle, and that's when this brace will help you by applying this resistance through the front pad the calf, onto your leg. So when your leg starts to buckle, that part of the brace will, keep your knee in an extended position, keeping it from buckling and keep, preventing the fall. Because of that, this brace will help you to walk longer because it minimizes fatigue, muscle fatigue. It's pretty much helping your quadriceps to reserve its energy. Once without the brace and you constantly buckle, partially buckling, your muscle gets fatigued from activating it to prevent you from falling. So if you have this brace, the brace is kind of like helping you, to have like a complete buckle. So that means your muscle is getting less fatigue and you can do most of your activities. And another bracing options that we use for myositis patient is the ankle foot orthosis. And this is a brace that we use for patients with foot drop. And this is a brace that will help the patients to keep put their foot in a more anatomical alignment so that when they're walking, they're not catching the foot onto the floor, causing them to stumble and fall. And this particular type of brace, it's a lightweight. It's made of carbon fiber, and it just slip into the shoe, and then you wrap it around your ankle. Again, not everyone will need this. If you're not able to, pick up your foot when you walk and it keeps on scuffing the floor, you may be a good candidate for this. Or when you're climbing upstairs, you keep hitting your foot onto the step when you're climbing, you may be a good candidate for the AFO. Next slide, please. Now, if all those bracing options still makes you fall, then these other assistive devices may be an options for you. Usually, depending on the severity of your muscle weakness, physical therapists usually, will let you use a cane first to see if that will improve your balance. If not, they move it from a single point to a quad cane, and from a quad cane to a rollator or a wheeled walker. So your local physical therapist should be able to assess your gait and your balance to see which one of these equipment will be appropriate for you to use. Next slide, please. What exercises would be good to complete to prevent falls?
Right. So a good bit of this are things that we went over in the past two talks, which are, I think everybody listening here knows how the different myositises affect different muscle groups in a fairly predictable pattern. And it's important, one, to try to exercise those muscles to get the strength back as much as you can. And then particularly in the case of the inclusion body myositis, not just trying to exercise those muscles, but exercising the surrounding musculature. So if you have a quadriceps or a dorsiflexor for your foot that's not really responding, at least all the other muscles surrounding that joint are as strong as they possibly can be to help you out with that. So I don't want to just kind of repeat all of those. I think you need to remember with the hips that we're talking about a whole range of motions. So it's hip flexion, it's hip extension, it's abduction, which is moving your hip out to the side, and adduction, which is pulling it in closer to the center. Knees a little more straightforward. It's just bending and flexing. So it's flexing and extending. The ankle, it seems simple, up and down, but it's really a much more complex joint, especially when you wind in the entire foot. And in our past talks, we haven't really talked about the foot. But when we talk about balance and not having falls, I think that the small muscles in your foot are very overlooked. This has nothing to do with myositis. This has to do with us all as we age and as we spend more and more years wearing shoes. We use those small muscles in our feet less and less. And they get weak, just like any muscle that's not used. And what you want to think about, I brought a ball. It's a handy device. Your foot anatomically is fairly similar to your hand. The big difference is we don't have an opposable thumb on our foot, right? But there are lots of joints in there. It can move in a lot of directions. There are a lot of axes of motion in there. And if you think about it, if you keep your hand really stiff and go to pick up a ball, you can, but it's really easy just to knock that ball away. But if you've worked the small intrinsic muscles in your hand, you can get as firm a grip with your foot on the ground as you can on a ball like this. So I always encourage people to think about, when you're walking, your foot is not just this rigid platform that hits the ground and you roll off. What really goes on with your foot is it hits the ground when your heel comes down, and then all the joints in your foot loosen, right? And they loosen to allow your foot to adapt to the surface of the ground. And when it's done that and you're ready to step forward, it tightens up again and propels you forward. So I think everybody, myositis or not, but as you age, you really want to make sure that you can use those small muscles in your foot to help with your balance, especially if you're walking around at home in bedroom slippers, in socks, barefoot, whatever, where your foot's really contacting the ground. It's kind of silly, the exercises for those intrinsic muscles in your foot. What I like to do is I like to get just a little bag of marbles. And you put the marbles on the ground and you try to pick the marbles up one at a time with your toes and drop them back in the bucket that you started with. It seems pretty simple, but the better you can grab with your foot, as you can imagine, if you're stepping and you start to lose your balance a little bit, if your toes can come down and help you regain your balance, you're going to be better off. The only caveat to using marbles to exercise your feet is if you go back to the environmental stuff that Megan was talking about, if you leave marbles on the floor, it's not a good thing. So I don't want to tell you to do this exercise only to find out, and now I tripped on the marble and fell down. But seriously, including some exercises for all of us as we age to make sure that we're able to really use our feet the way they were meant to work is a helpful thing. The muscle endurance training, again, this is stuff that we've hit on before. Myositis is a disease of endurance. It's a muscular disease that essentially affects the endurance in the muscles. And so, again, as mentioned by Megan earlier, the more fatigued those muscles get, the more likely they are to not support you the way that you want them to. And that can lead to falls. So just continuing with those general conditioning programs that we've talked about over and over, where you're not just trying to strengthen the muscles, but you're doing a lot of repetitions when you're trying to strengthen the muscles, and you're doing some basic aerobic work, whether it's a stationary bike, whether it's walks, whether it's swimming, whatever you like, but just making sure that you're addressing your endurance. When it comes to the stretching exercises, the one that I think Ruben and I think is the most important is your hamstrings, the back of your thighs. And if you think about it, the weaker that your hips get and the weaker that your quadriceps get, if you have the inclusion body myositis, the more likely you are to get tighter and tighter in the back of your legs, right? And so you want to stretch those out, because if they're too tight, you can have a tight enough hamstring that even if you wanted to be able to to straighten out your knee completely, if you're getting weak and your hamstring's really tight, that can prevent you from being able to fully extend your knee. So unless you have some decent range in your hamstrings, it'll be harder to extend your knee and straighten your knee. The easiest thing, the absolute easiest thing to stretch the hamstring is just in sitting. You just prop that foot up.
You can put a towel.
You put a little towel roll or whatever underneath it, so it's there. And then the important thing is what you do with the small of your back. Because if I do this and then I slouch over, I get no stretch here in the back, in my hamstring. But if I have my leg extended like this with something underneath it, and then I try to sit up really straight, you know, like good military posture, shoulders back, butt tucked in, you'll feel a big stretch in the back of your hamstring. So you just make sure you're sitting up straight for, 20 seconds, 30 seconds, and then let yourself relax. But then when you want to stretch it again, chest out, shoulders back, small of your back arched a little bit, and you'll feel a good stretch there. And again, that just is a way to kind of make sure you can get that last bit of knee extension a little bit easier. Because if you can't extend it all the way and it's weak, again, it just makes it a lot easier for that leg to buckle and for you to have a fall from that. I did want to go over some exercises a little bit more specific to balance, because as important as strength and endurance are, there are plenty of studies out there that'll show you that they're very helpful, but the balance is its own unique activity, right? And unless you practice an activity, you don't get good at it. So balance exercise is a little bit different than the strengthening exercises. And when you think about balance, what we talk about usually in the therapy world are, it boils down to what we call stepping strategies. You start to lose your balance, and what do you have to do to catch it? You have to quickly step. And if you're somebody who has a muscular disease that has given them a lot of weakness around the pelvic girdle, like maybe the dermatomyositis is, and some of the other myositis is necrotizing myositis, where maybe it's the extensors that are feeling it particularly weak, or inclusion body myositis with the quadriceps and the dorsiflexors. Stepping is something that you guys tend to do very gingerly. The more you slow down your stepping because you're concerned with a fall, the more you kind of lose that ability to respond to the challenge of losing your balance a little bit. So being able to step somewhat quickly and being able to be comfortable on a single limb or with a very narrow base of support are really important components to getting your balance. So I printed out, so these are just some generic balance exercises that I can, I'll send off to Jerry and see if it's something that can be posted there. Again, one size doesn't fit all, but I was going to show them to you real quick so you can have some sense of what I'm talking about. The first thing I really do, just like with the marbles, please don't lose your marbles in more ways than one, but when you're doing balance exercises, please, please, please do them in a safe manner, which means by a chair, by a countertop, by something where your arms can grab hold and make sure that while you're practicing your balance, you don't have a fall in and of itself. So the first thing, very basic, it's just single leg stance. So Ruben's just gonna bend one knee behind the other. He's holding onto the chair to get the leg up, and then you just practice letting go. But I like to keep the hands hovering right over the back of the chair. So as soon as you feel like something's not gonna hold you, you just put those hands down and lower the other foot down. And you just go, foot to foot, single leg stance like that, okay? You can see if you're doing it and you're standing up straight, it's also good to strengthen your hip. It's also good to strengthen your ankle, all right? So that would be the first one. The second one, we call it tandem stance with support. So this is almost like a drunk driving test. So Ruben's just going to put one foot right in front of the other. And what this does is it gives you a very narrow base of support. Again, he's holding onto the chair, but then you just kind of want to let go, let yourself balance, and then put your hand back down as soon as you feel like you're losing your balance. And even if you're not losing your balance, if you're doing it well, usually if you can hold these poses for 10 seconds, that's plenty, okay? All right, the third one is, it's another single leg stance thing, But this way, this time, it's going to be a single leg stance where you're going to just step forward with one of your legs and then bring it back. Okay, and not all the way back, but just kind of straight down, single leg stance and coming down. And so if you think about, I'm going to lift up this foot, I'm going to bend this knee just a little bit so that that muscle's having to work. And can I let go? Pull my legs forward. Can I bring it forward, let go, and then grab it back down? Okay? And then you're going to do the same thing out to the side. So you hold on, you got the leg out to the side, you bend just a little bit with that leg that's still on the ground, and then you catch yourself and bring it back in. Right? So you did it forward, you did it out to the side, and then you do the same thing backwards. And I realize, especially for some people who have had IBM for a while, that idea of letting the knee bend just a little bit while you do it is not something that you're going to want to do or feel comfortable with. So again, you have to exercise where you are. Don't try to do something that is going to lead to a fall. But even if you're doing that with a locked knee, it's going to be okay. So that goes in 3 different directions: forward, to the side, and back. The next one's going to be these little lunges to the side. And lunges probably also sounds like a scary thing, but it's not. It's just getting comfortable to taking a step out to the side and back in. And, you know, again, you do it in front of a countertop, so you're holding on. But if you think about it, when you start to fall, you start to lose your balance, one of the first things you have to do is reach to catch yourself, okay? And so you want to be comfortable doing that. And then you also want to get used to doing it kind of quickly, okay? So mini lunges out to the side. A little bit simpler than that and kind of a lead into that, so I probably should have put it first. Or just some weight shifting side to side when you're holding on. Again, this is part of just getting used to just standing on, having all of your weight go through one leg, all right? And you should get used to shifting. As you do it more and more, you want to do it faster and faster, because again, that's kind of what you have to do to catch yourself when you start to lose your balance. Now, for people who feel like their quadriceps are actually still in pretty good shape, the braiding, the cardio kind of thing. There is an exercise where you kind of cross your leg in front and then step out, and cross your leg in front and step over. Again, I would have you do this in front of a kitchen counter, in front of a dining room table, somewhere where you have a surface that you can keep your hands above in case you need to catch yourself, in case you start to lose it. But if you look at people who start to fall, what their hips are going to do is one of 2 things. Either if I start to lose my balance to my right, to this side over here, I'm either going to step that way to catch it, or I'm going to step across to catch it, okay? And so you just kind of want to practice both. With those little lunges to the side is catching it one way, and the other way is, well, whoops, can I step over and help myself catch? Okay. So that's that one. And then the next 2, or again, just holding on. I did show, I like using these balls on the ground for ankle strength. And so I have shown, we did go over that some in one of the other talks, but thinking about it for balance here, again, you kind of keep your hand by a surface to keep yourself comfortable, but you're just rolling the ball forward and backward, all right? And what's really working is the leg that doesn't have the ball under it. So just by moving it forward, moving it back, you're making In this case, his right foot has the ball, so his left ankle is working kind of hard to keep his balance as his right leg goes back and forth. And so you can do it back and forth, and then you can also do it side to side with the ball, where you're holding on. And so these are exercises, again, they're not meant to build a lot of strength. They're meant to improve your balance, so you maybe don't have to do as many repetitions, but what part of the goal should be is, can I start doing them kind of quicker and quicker? Because catching your balance is a reaction. It's a quick reaction. So if people would like, we'll try to get these ones just as kind of a generic group of things to start working on up there. But I think that's an important component to prevent falls, is not just getting stronger, not just getting better endurance, but working a little bit specifically on how can I weight shift, how can I be comfortable with a narrow base of support, and how can I move a little bit quickly, comfortably. So the next thing we kind of wanted to talk about is, well, what do you do once a fall has occurred? And part of that is going to be getting up, but there's an important step before getting up. And that is, making sure the person's okay. So the first one is for a caregiver. If your partner has had a fall, first off, if they're unconscious or unresponsive, it's a 911 emergency. I think everybody's kind of aware of that. The important things are to try to remain calm. If you can, what the ambulance crew that's coming are going to want to know is the person breathing well? So you're paying attention to, are you breathing? Can I find a pulse? If you're comfortable finding a pulse, the easiest one is up in the neck. You find that Adam's apple and go right to the side, keeping an eye on that, looking at the skin coloring and the pupils. You don't want to see pupils that blow up or they go down, but not that you can do anything about it at that point. If they're unconscious, unresponsive, you look for signs of bleeding, signs of swelling, and you just stay put and stay by there and wait for help to come. So if the person is, so on the next slide, if they're conscious and alert, but they've had a fall, you don't want to panic. You want to kind of just stay calm. And the first thing you want to do is try to assess yourself. Are there any serious injuries? And so talking to the person, making sure that they can answer you and answer you appropriately. Looking for, is there any bleeding anywhere? And then also just kind of looking, before you try to get up, you should have a sense, well, could I have broken a bone? I think everybody needs to realize, obviously as we get older, people tend to it's very common to get a little bit osteoporotic. So your bones are a little bit more fragile. If you've had a muscle disease and you're not on your feet, walking, moving as much as you used to, that's another risk factor for somewhat brittle bones. The easiest thing what we really worry about are breaks in the big bones, the long bones, like your humerus bone or your femur, your thigh, a hip fracture. And the easiest way to just kind of judge yourself if there might be a problem with that is we just call it rolling the bones. So I'm going to grab Ruben's arm here. So if he's falling and he's like, oh, my arm's killing me, I hurt myself, I landed on my shoulder. First thing I would do is it okay if I just do this? Because a gentle roll won't damage anything, but if this is really painful, that's a big warning sign that there might be a fracture up here, right? And so then, you don't want to start forcing somebody or trying to get somebody up on their feet if there might be a broken bone there, because you can make the break worse by forcing them to use it. The exact same thing can happen with the leg. I'm just going to put Ruben's thigh up here. So if the person's fallen, they maybe landed on their hips or on their buttocks, and they're in a lot of pain, and they're lying there like that, if you can just take their leg and just a little roll, not aggressive and not seeing how far you can go, but just a little roll. If there's a hip fracture, this is usually an excruciating thing, and so you just stop and assume that it is. A lot of other fracture things, if that's okay, there's a good chance there's not a fracture there. Okay, those are the main things. If whenever in doubt, you call 911. You know, it's better to have them intervene earlier than to have you try to get somebody, help your loved one get up and realize that you've caused a bigger problem. But just for some peace of mind, look for responsiveness, look for conversation, look for bleeding, do gentle rolling with the arms and legs. If they're okay, there's a good chance that that you can move on and try to get up on yourself. Okay. Let's go ahead to the next slide. Getting up or helping somebody get up after a fall is probably one of just the best advertisements for, oh boy, I really should do my exercises and I should do them all the time. Because we're going to show you a few techniques for doing it, but they all require strength. You know, there's no getting around it. And so again, if you're exercising regularly, if you're maximizing your strength, it is just going to be easier to deal with these things. So we have some slides, but we're also just going to kind of demonstrate. Do you want to do the camera? Or?
I'll do the camera.
All right.
And before they demonstrate, I just want to say a quick thing. This is also really a good point to talk about always having something on you where you can call a caregiver. Smartwatches are kind of the new and in thing and can be a really great way to always have something on you to contact a caregiver, keeping a cell phone on you, keeping one of those life alerts on you. But you never want to be in a place where you are down on the ground and you have no access to contact someone. So this is a nice preventative way to optimize the situation of a fall.
Good.
Good. I would also like to add, don't forget to call your doctor, because sometimes they may need to do some follow-up on you, do some testing, and try to observe for any emerging signs and symptoms the next few days, like headaches or if the cognition is getting low or getting sleepy and things like that, that may be a sign of like some internal bleeding and stuff or head trauma.
Yeah, and then that's a really good point Ruben has. And I was at a talk by a bunch of primary care physicians, and that was one of the points that they were making is really how seldom do they know when their patients have had falls. And it's a really important piece of information for all of your caregivers, all of the medical caregivers that you have to know. And a lot of times the word never gets back to the primary care person, but trust me, they would always want to know how often it happened, why did it happen, and what happened because of it. Okay, so getting up with a caregiver's assistance. I think that I'm gonna be the fall person who fell.
Okay.
Yeah.
So it's very, if it's nice to have a gate belt, so you have something to hold on to when you help the person to get up, or just grab them by the belt. But here this time I'm gonna use this belt.
And I'm gonna go fall down.
Now, is that just a standard gate belt?
Can you hear it?
Yeah, that's just a regular gate belt.
Just a regular gate belt. Yeah. Okay. So you okay, Phil?
Yeah. Help me.
So first is lay the patient on their back and then try to bend their knees. And then you want to help them to roll onto their stomach because you want them to be in a all-fours position or in a crawling position. Gently move their hips. Let me go this way.
Hips and shoulders.
Hips and shoulders together. Here's the trick. Yep.
So again, the important part is hips and shoulders together Helping them get into all fours.
Yes.
Okay.
And the caregivers needs to protect their back as they're helping their loved ones. You don't want to hurt yourself as well. So bend on the knees. Bend on the knees, keep your back straight, and use your legs. There you go. And then you help them to crawl to a nearby sturdy furniture, okay? First, next thing is you have to bend the stronger leg. Let's choose a stronger leg. Let's see this one. And you want to make sure that the stronger leg is bracing the bed or the chair for support. What I'm going to do here is I'm going to ask Finn to help me. So you shouldn't be lifting the whole weight. You should encourage your loved ones to help as much as they can. So 1, 2, 3, up. Yeah. All right.
Yeah. And so, as you're trying to stand up, when you're if you get the person who's falling, once you get them on their knees, leaning against the chair or the bed, if you're trying to stand all the way up at once, that's really hard. You're lifting their entire body weight. But if you think about you've got your knee bent, you have it braced up against the bed, and all I'm doing is lifting my butt. My shoulders are staying down low, okay? I'm not lifting nearly as much weight. So if your head stays down and your butt goes up while your head stays down, essentially the person's much lighter that way, okay? So if you're having trouble, keep the head down, just try to get the butt up and around. I hope that makes sense. I mean, honestly, if the caregiver's not around, you're still going to try the same thing. You've fallen. The first thing you want to do when you've fallen is almost the same thing as if the caregiver was there. Don't try to rush and get up. Try to make sure you're okay. Can I roll my leg? That's okay. Can I bend it? Is that okay? Same thing with your arms. Can I move them? Can I roll them? Am I okay with that? You're still going to try to do the same thing. For the first thing is to kind of keep your body, the shoulders and the hips together as you just roll yourself onto your side. Try to get your arms underneath you so that you can try to get onto your hands and knees. You crawl to wherever there's some place where that you can grab. And again, it's really important that you're not trying to stand up straight from there, because that takes a lot of work. But if you're holding onto the chair, holding onto the bed, all you're trying to do is get your butt up and your upper body staying low until you can push yourself up. Okay? That's just, again, all of this takes some strength, but that is the easiest way to do it. If you're going forward, if you can get yourself onto all fours and then up into a crawling position. Sometimes I think this is harder. We'll use the stool. But you can also kind of back your way up to a chair.
So we're using a stool to serve as a halfway transition point, from the floor to the bed. So we're using a backward method where you scoot.
Yeah, so you're going to scoot yourself until you're resting up against the stool. If you can get back there with your hands, if you have one leg that's stronger than the other,
yep,
you're going to lean back into that stool and push with that leg, okay? And just try to drag yourself up to halfway there and then get yourself around from there to the last little scoot. I think that takes more strength than the first way. It's a little more straightforward, and Ruben will show you there are some assistive devices that can help you with that a little bit later.
But But I think on the other slide you can see the rescue up on that slide where it says backward method using arms. Yes, so you can see the rescue up step ladder. It's similar to the stool that we use right here, but the difference is like it's like a ladder, you know. So it served like a halfway transition point from the floor to the chair or to the bed. And I think I put that reference in the at the end of the slides.
And then you can do the hip hike.
Yeah. Now let me do the hip hike. I think this is a difficult one to do. But if the other technique doesn't work, then you may want to try this one. So again, this works best with a in this case there's a pull-out mattress that serves as the transition point, halfway transition point. But I'm gonna use the stool to do this. First thing is you need to scoot back to the nearby sturdy furniture. What you do here is you gotta bend your stronger leg first and reach across your body. Put the elbow on the stool. What you're gonna do is you gotta lean forward and you gotta push down with this hand and this elbow to lift your hip up onto the stool.
And that one probably takes the most strength
And then you
of any of the three methods. I think the first one, people are able to do that when they're maybe at their weakest. The second one requires a little more strength, and I think this one requires even more strength than the first two. But, you know, going with any of these, you can try any of those methods, even if the caregiver's there. And what they're going to primarily do is kind of help guide your hips as you go along. You don't want, as a caregiver or, you know, the patient, you don't want to be grabbing people's arms or legs to try to pull them up, because you want them to use their arms and legs to try to move themselves. So if you're helping somebody, like if I'm helping Ruben, it's better to grab around the shoulder blades, and
not the neck,
scapula, not the neck, but down around here, not grabbing his arms, because his arm's trying to do some work. And the same thing with the legs. You don't grab the legs, but you get around the pelvis, you know, around either side of the hips to help guide. Okay?
This is just a list of some transfer and fall recovery equipment that I found online. And some of these we use here in the clinic. We have this chair booster called Kaboost, right? That it lifts up your chair to like 4 inches, I think, which is make it easier for somebody who has problem with their legs to get up.
Yeah, it's a little plastic device that again is good for over 300 pounds.
Yeah.
It's spring loaded, so you can stretch those leg components out for different size chairs. And then they just kind of snap back and raise up the height of the seat.
And then you have this portable lifting seat, what you call it, like a booster or something like that.
Which is, again, it's kind of a hydraulically
Hydraulic
loaded lift. So it's down flat when you're not using it, and as you shift your weight, it helps lift you on up.
There's also like an electronic version of that where you push the button and then it lifts you up forward. And then the Hoyer lift, this is primarily used in the clinic. And the extra thick seat cushion, I think you can get it like 10 inches thick to help you get up. And then we have this BC board, which is a transfer board. So this is a device that you use to transfer from the bed to the wheelchair. And as you can see, there's like this round disc in the middle, and that moves. So the person can sit on that round disc. So from one end of the BC board, they can slide their butt over to the next surface to help them transfer. And then you have this gentle boost uplift assist commode, which can serve as a commode and a shower chair. So it's a multi-function device that can be used as a freestanding commode over a toilet or as a shower chair. So what it does is, as the patient leans forward and then they push down on the armrest, the seat will start to rise up and helps the patients to go up and forward, helping them to stand up. And then you also have this lifting cushion, inflatable lifting cushion that can help a person get up to you can inflate this to I think 22 inches chair height, and that will help them get up to a standing position.
And I am sure that is not a cheap piece of equipment.
Yeah, it's an expensive one.
I would say it is. We have something very similar here in the hospital to help get people up off of the floor. So it's when you haven't fallen, it's actually fun to use. You feel like you're going on a ride, but I don't know exactly how much it costs, but I'm sure it's not cheap.
Now, this is another expensive equipment. It's a patient human floor lift that's battery operated. So the person has to scoot onto this platform on the bottom, and then there's like an armrest that they can, just to safeguard them. And then there's a push button that they push and lift them up to like a chair height position. The last time I checked it online, it cost like around $2,000 to $2,500. So, but it's portable. It got wheels and can be moved around. So for more information about falls and fall prevention, I found these 3 websites: the CDC and the National Council on Aging websites. They have these fall prevention initiatives that they have to address the growing health issue of fall-related injuries in older adults. So you may want to explore this website because they gave you like educational materials about falls and fall prevention. In particular, the CDC website, they have this fall initiative called STEADI, STEADI. It stands for Stopping Elderly Accidents, Death, and Injuries. So in that website, you can find brochures, different tools, brochures for family members to help their loved ones from falls, some safety checklist brochure to identify and eliminate fall hazards in the home, and other checklists that help you determine, your risk of falling. And another cool website that I found is this website from the University of Southern California School of Gerontology. It's called homemods.org. So if you're interested about home modification to make your home safer, this is a good website to look at. It provides a national directory of home modification programs and service providers in each state, including funding sources, educational materials for home modification, and how to make your home fall-proof.
Okay, thank you guys so much. And we're going to go now. Was there anything else that you wanted to kind of close out with before we start our Q&A?
If I could interrupt just for a moment, just because you mentioned that website provides information about funding sources. I doubt that ours is on there, but we do provide a financial assistance program for myositis patients that does cover assistive and mobility devices. So that information is available on our website along with the help guide and the application. And it's not a huge application. It's not a big process. So please check that out.
Good.
Okay. Thank you, Jerry. We'll start with the Q&A. For Marcia, I exercise in a swimming pool with stairs and 2 railings. I can't get up the top 2 stairs. Can the easy step help?
I mean, I haven't had my patients try that. The biggest thing is like the resistance you get from stepping up and out of a pool. That's a good question.
So with stairs and 2 railings, if it has a railing and you're already most of the way out of the pool, I would think if you have a lifeguard that's there at the pool that can be standing by, if it's a real obstacle, it's worth exploring because swimming's such a good thing for you that I wouldn't want that to rule it out. You worry a little bit, they're hollow underneath, you get water under there, you're pushing it. I don't want it to be an unstable thing that throws you off. But I think it could help you, because if the steps are rungs, it's not going to help you if they're just rungs to go up. But if it's a pool that has some cutout in the cement kind of steps, then it would be something that you could try.
But they do have a lot of public pools have to have the lifts that go in and out of pools. You might also want to consider those.
Yeah, a lot of them have either ramps or steps that drop on in, so they just for the accommodations.
Okay, thank you. So next question. I often have to replace my shoes when I wear my AFOs. Is this because the heels wear out quickly? Any suggestions to help slow down that process?
Well, I mean, it's gonna happen with the AFOs. If you can extend the life of heels with really just some kind of rubber cement products, like the old, I don't even know if they make it anymore, shoe goo they used to have, where you could put that, it hardens like rubber cement very quickly on the soles of the shoes. You got to be careful, because you don't want to build yourself up and create bumps on the sole that will make you less stable. But as a heel's wearing down, if you put it on smoothly, one of those rubber glue kind of things, you can get some more lifetime out of a shoe that way.
A good resource also is to go back to the brace person that where you got the brace. Sometimes they can offer you some recommendation in terms of like the proper type of shoes that you can wear, or any other orthotics that you can use inside.
All right, and kind of along those lines, the next question is, the shoes in the picture with the AFO look like my Dr. Comfortable diabetic shoes. Are they diabetic shoes? And if not, what type of shoes do you recommend with AFO?
Well, so, I mean, the orthotics usually make your foot a little bit wider than it normally was. And so I think a lot of times some of the diabetic shoes that just have the Velcro closures, a lot of people end up using with their AFOs because they think it's kind of easier. It's going to be a personal decision. All you have to think about is, since there's a post coming up the side, that essentially your foot's going to be a little bit wider than it was before. So some people are going to an extra half size of the shoe. But if you have a pair that you really like, we know plenty of people who just use regular tie shoes, whether it's almost like the hiking boot types or running shoe types. But then some people just like almost the diabetic type, where they're just going to Velcro over.
Okay, next question. What should I look for when buying a stationary bike?
So the very first thing you should look at is, can I get off of it okay? Can I get on and off of it? And realize that when you're getting off of it, you're tired. And those quadriceps might not be holding you up as well as when you got on it. So honestly, that is the primary thing is, if you're going into a store and you're checking things out, or if you're going into a gym, it's like, what can I get on and off easily? It's realizing that when I get off, I'm fatigued and not. If you find one that you can get off on easily, I think that the best thing and the most important thing to look for is something that it's easy to adjust the resistance, because then you can use the bike for two things. You can use it as, if you put the resistance up a little bit high, it's a good strength builder for your quadriceps. And it also, if you have nice loops for your feet, you can kind of try to pull the pedals up with your feet, and it's a good exercise for those dorsiflexors, for the shin muscles there that are weak, especially with IBM. But then if you're using it more for the endurance, you just keep the resistance down, and so you can pedal for a lot longer, and you get a more of a cardiac workout. So variable resistance, but first making sure that you can get on and off of it. Yeah. So it's not too low to the ground.
Thank you. I can, next one from Lori. I can only lift my leg about 3 inches from the ground, so I need assistance on steps. What exercise, and maybe you showed this, can I do to increase my range?
Okay.
I think what it meant is like you cannot lift your leg straight up this way to get to the next step. So one exercise you can do is to strengthen your hip flexors. You know, you can start holding onto a chair, and then you can start with no weights and lift it up as high as you can go, simulating as if you're going up the steps. Sometimes you can put like something on the floor, like a book or something, where you can, that can serve like a target. You can increase the height of it to match your step. And your goal is to lift your foot up so that it can go that high. And keep practicing that until your hip flexor gets stronger and you're able to, you know, get to the next step. You know, as you get stronger, you can put like weights on your ankles, and then that can also, you know, provide you with some challenge as you do your hip strengthening.
And if you're feeling like it's too weak and just gravity itself is preventing you from getting it up, then if you're laying on your back and doing it in bed and basically trying to pull knee up to chest, you can loop a towel around your foot to make it a little bit easier, but you don't want to be using your arms to pull it up. You want to be making that hip muscle do it. That might be an easy first step if you're just finding like gravity itself is not letting me go up any higher than this.
Okay, have another demonstration if you could, please. Can you demonstrate lifting with a large towel or a butt sling with 2 individuals if the patient's quads are too weak? Can you demonstrate that?
To help them get up?
Yeah.
To help them stand up?
Mm-hmm.
Well, I mean, so we can. We kind of don't like using those too much here, and I please chime in with me. What certainly my experience over the years in the hospital is honestly sometimes one of 2 things can happen. One, you just can rip the sheet that you're using to help somebody get up, and then you have somebody who's going to fall from the sheet ripping, or it's sliding out of hands and it becomes kind of an unstable thing as they're coming up. So I would try to shy away from it. I wonder if this question is from somebody where they're needing 2 people, and so they're trying to get on either side of a sheet to help.
He does follow up saying that the EMTs had used that technique when they had a fall.
Maybe take a look.
Yeah, and we always see some people in the hospital using that technique, but again, you see it enough, and eventually you are going to see towels or sheets rip. Sheets, if me and Ruben are doing it and we're picking Megan up with the sheet, and you know, what if Ruben's stronger than me or my hands start to slip, and then all of a sudden they're out of cattywampus, they're going off to one side. I think when it comes to the lifting, even if there are 2 people being, actually Megan, can you come to the other side of Ruben? What's oftentimes a better thing is getting down as low as the person, even if you're on both sides, maybe getting my knee, blocking his knee a little bit, pushing him forward and helping him come up from his back. You can't really see it on the screen, but I'm keeping one leg in front of his, right? So I can kind of control his knees. Here, we can come back down and pretend that Megan's on the other side so she can hold the camera. So even if you're getting 2 people, I'm going to be squatting down. I'm going to kind of have the fleshy part of my thigh into his knee so it's not bone on bone and it's not painful. I'm going to keep his shoulders forward so I'm not trying to lift him straight up. And we're going to come up, forward, and then up, always with my leg in front of him. And if you're kind of controlling the hips and the knee that way, you can get we do it all the time. We have a lot of small therapists in our department.
I was about to give my 2 cents because I'm one of the people that when patients see me, they look at me with 5 heads and say, "You little thing, you're going to get me up." And to be honest, I never use that sheet method. The gait belts, or I take a sheet and tie it around to simulate a gait belt, is a much better tool, like using physics as a way to help you get somebody up. So
Yeah.
So if you do require 2 people getting somebody from the floor, what you just showed, that would be the best way if you don't have any equipment or like a Hoyer lift or something like that.
Yeah, and you know, really, if they're on the floor, like when Ruben was over there and we just wanted to get him up a little bit onto the mat or the chair height or whatever, what you really want to just concentrate on are those hips, you know, and you want to do as little lifting as possible. You're trying to keep the rest of the body as low as you can, so you're not lifting it up. You're just getting the hips up as high as they have to go. And you really, little people can move big people when you're doing it that way.
Great, thank you.
Okay, thank you. The next question is from Jane. Presently looking at purchasing a gait belt, do you suggest the metal buckle that you pull to lock or the plastic buckle that you pinch to release?
The ones that we use, all of the ones here are pinch. And they seem fine. A lot of the metal buckles are on the cloth.
Yep.
The old cloth gait belts.
Sometimes they have, you can buy sometimes with a loop for you to hold on, right? Like the one that we have.
Yeah. You guys, I'll run and get mine. Well, you get the next question.
Yeah. Then we'll get the sample gait belt that we use.
Okay, well, I'll take the next question then here and then we'll come back to it. Does the base of an easy step come in a larger size or is it just that one size?
I think they only come in on this size, but I'm not quite sure.
I would check the website.
Yeah, check the website. I'm not sure if this is the only size that they have.
Okay. Thank you. Go one more here. Due to COVID, pool therapy is not available at this time. Are there resources available for pool therapy exercises that I can do in my neighbor's pool?
I mean, we don't do so. I mean, my recommendation would be reaching out to a physical therapist that does like aquatic therapy if you want specific exercises for that. We don't have access to a pool and we don't do pool therapy here. So I don't know. I know I personally don't have a bank of pool therapy exercises.
Well, I guess one of the pool exercise you can do is, you know, because you won't fall in the pool. The water will support you. It's basically, let me just demonstrate. One of the exercises where you're in the pool is doing the squats. You know, you can do like squats like this. You can use the paddle board. You can sit on the, I don't know, like side of the pool, and you can use your quadricep to push through the water.
Exercises
In the pool.
In the pool. And I think the pool allows you, even if like, it gives you enough support. So if you're somebody who tends to walk with locked knees and things like that, you can kind of mimic a more normal gait pattern in the water because it's supporting you and you can just hold on to the side and go back and forth. And that's a helpful thing, just to mimic normal mechanics. So I know we said we don't endorse products, but this is kind of an example of a gait belt with a lot of handles on it. So you have loops that are basically parallel to the ground and then also perpendicular to the ground. It's cloth. It does have a plastic hook or clasp. I like it, again, particularly for those of you out there with only one hand, the loops are fantastic in all the different directions. But I think that kind of makes it easy for people to grab hold in multiple, either this way, whatever, to help. So.
And what is that called? I know that we're not endorsing it, but what's the name of it?
We're not endorsing it, but if we were, it's called Secure. It's the company.
Secure. Okay.
Secure. Yeah. And it stays in my office, so I never lose it because I like this one a lot.
Yeah, I'm sure that's probably, you run into that sometimes. You have to hoard it.
Yeah.
Okay, our next question from Jimmy. I mainly have a problem with knee buckling. Would the how do you pronounce it? Grafo, Grafo, be the best device for me?
Well, it all depends on how severe your quadricep weakness is. You know, if usually we recommend this for people who can still able to kick their leg like this. If you're still able to do this, keeping your knee straight with a slight extension lag, you may be a good candidate for that. But if you're not able to, if you can barely kick your leg out, you may not be a good candidate for the ground reaction AFO, because if it starts to buckle, the brace won't be able to hold you up. You'll be on the ground.
Right. You reach a point where you have to rely on locking your knees.
Yep.
To for any kind of stability once your quads are weak enough. And once you've gotten to that point, that ground reaction force orthotic essentially loosens it just a little bit.
Yeah.
And so for people who are that dependent on, we call it recurvatum, on snapping back, the ground reaction force orthosis can actually make them less stable. So it's kind of, it's a wonderful tool. It's a wonderful orthotic for people who are starting to lose quadricep strength, who have a bit of a lag. They can't quite get it all the way straight when they try to kick out their leg. It's wavering a little bit. But for the ones that have lost enough of their extension strength that they can barely budge it when they're sitting on the edge, they're beyond ground reaction force orthosis.
Thank you. Okay, we've got a couple more here. First, do you recommend a recumbent stepper exercise bike like the new step? And I know you can't endorse them, but
well, we don't endorse anything. Well, so to me, honestly, and I jump in. I'm sorry, other people need to talk more than me. But the biggest obstacle is getting up. To me, is that they tend to be kind of low. Any of the recumbent things, and so. Again, especially when you've finished and you swing your legs off the side to get up, you're getting up from a fairly low surface.
Sometimes my patient was difficulty getting up. I end up using like a pillow, extra 2 pillows to help them get up after the exercise.
Yeah, so that would be the only caveat if you're looking at those. They're wonderful pieces, but they just might have a seat that's a little too low.
Yeah, one thing I like about the new step is that you can slide the seat back, and you can, by sliding it back, you can focus more on your quads. And then when you move it closer, you can see that you're activating most of your hip muscles. And then it can turn to the sides too.
okay, well, I think that covers the questions that I found in the Q&A. So I think we are at the end of our session.
Thank you. That was great questions, everyone. Great information, Ruben, Finn, Megan. We always appreciate your expertise, your opinions, and those demonstrations, because those are always so very helpful. Our website is understandingmyositis.org. And then if you're interested in sharing your experiences as a patient or caregiver, visit myositislife.org. And that's, a place where you can share your stories, your experiences, either as a written story typed out, short videos, photos. It really does help other people to understand better. So those are always encouraged. And then you can always email us at info@understandingmyositis.org. Thank you. Ruben, Finn, Megan, did you have anything that you'd like to close with before we let you guys go home and eat dinner?
No, I think mostly for me, it's just thank you for inviting us. It's a pleasure to do these things, and I hope they're helpful.
Well, I can tell you firsthand they are. The comments and praise that we get is phenomenal. So you are making a difference, not only at work, but in your off time as well. So we do appreciate it, and we wish you all the very best and enjoy the rest of your evening.
Okay, thank you very much.
Thank you guys. Good night.
Bye-bye.